Everyone. This video is going to be an overview of the Affordable Care Act. The Affordable Care Act is one of the most misunderstood and misrepresented pieces of legislation in U.S. history, in my estimation. So it is my hope that through this video, we can break down what the Affordable Care Act was, what it wasn't, what it accomplished, and where it fell short. So hopefully we can all be on the same page moving forward as we explore different issues that are necessarily impacted by the Affordable Care Act. So the Affordable Care Act, or ACA, sometimes called Obamacare, sometimes affectionately, sometimes derisively, was legislation that was signed into law by President Barack Obama in 2010. It came at a time when the US healthcare system was really in crisis. There was nearly 50 million Americans who were uninsured, about 48 million. Um, and at that time, pre-existing conditions were able to be routinely denied coverage. So people with pre-existing conditions were unable to get health insurance oftentimes. And even if you had health insurance, healthcare costs were rising rapidly, much faster than American families could keep up with, and even so fast that employers and businesses couldn't keep up with that rise in healthcare costs. So the ACA was designed to address some of these issues, primarily through expanding access to insurance, by providing some protections for patients, and by trying to control costs through a few different measures. It's important to understand, though, right away that the Affordable Care Act did not create a new healthcare system. It worked within the system that existed at the time, and provided some incremental reforms to that system. So it included a mix of private insurance, employer-based coverage, and government programs like Medicare and Medicaid. So one of the big misconceptions that we see is people claiming that the Affordable Care Act or Obamacare is universal health care. It was not universal health care. It is not socialized medicine. The only socialized aspects of the Affordable Care Act legitimately that can be clearly pointed to. I think that there are arguments that can be made for some portions of it being socialized in terms of subsidies, but the only truly socialized aspects of the Affordable Care Act were programs that already existed, which were Medicare and Medicaid. So let's get into this a little bit further and explore exactly what the Affordable Care Act did. So the ACA brought a lot of major reforms and some minor reforms to the healthcare system, but it really kept the foundation of our healthcare system intact. Like I said, it did not create a new system. It did not implement universal health care. So let's look through the biggest changes that were implemented. So the individual mandate was a major change. At the time, at the passage of the ACA, most Americans were required to have health insurance or pay a penalty, usually at the time when they filed their taxes. So the idea there was that if we required healthy people to buy into the program, to buy into health insurance, this would help keep insurance markets stable, while we brought in a lot of other people who otherwise had been excluded from health insurance, maybe due to pre-existing conditions, maybe due to high cost of care. But if everyone participated, we could have a more cost-sharing model that would help stabilize the market. At the time, we also had an employer mandate. So this meant that employers with, I believe it was 50 or more full-time employees, had to offer health insurance or they would face penalties. Um, and so this really reinforced that link between the employers and the insurance coverage, which again was already a staple of our economy, is already a staple of our healthcare industry. But it allowed individuals who previously had not been offered health insurance through their employer to then gain access through their employer and have a cheaper option than purchasing an individual healthcare plan, which at the time prior to the ACA was prohibitively expensive for most individuals. Um, It also, probably one of the most important changes brought about by the ACA, was it required companies to um, cover individuals with pre-existing conditions. You could not deny an individual coverage due to having a pre-existing health condition. And prior to the ACA, this was a major issue. If you had a chronic health condition like diabetes or hypertension or high blood pressure, anything like that, you could be denied health coverage. Some insurers would even deny if you had a history of cancer or a history of pregnancy, you could be denied coverage, or could be selectively denied coverage for those items. So if you had a history of pregnancy, you could get a health insurance plan that would cover everything except pregnancy. Or if you had cancer, you could get a health insurance plan that would cover everything except cancer treatment. I had a friend who, prior to the ACA, had developed type 1 diabetes while he was uninsured. He was unable to get health insurance. And when he did, everything was covered except insulin and diabetes supplies. So that was a very common occurrence prior to the passage of the ACA. The ACA made that reform that required insurance companies to cover pre-existing conditions. The other major change that was brought about by the Affordable Care Act was Medicaid expansion. So initially, all states were required to expand eligibility for Medicaid. So individuals who, I believe it was up to 138% of the federal poverty level, would then be eligible for Medicaid. So previously, states had different eligibility requirements, and the Affordable Care Act mandated that all states expand eligibility for individuals who met a certain income level or below, and it standardized that level. So that was a significant change. Additionally, a major change in the Affordable Care Act, or a reform the Affordable Care Act brought about, was it expanded coverage for dependents until age 26. So prior to the Affordable Care Act, individuals would be kicked off of their health insurance plan, their parents' health insurance plan, rather, oftentimes at 18, sometimes 21, sometimes it would depend on whether or not they're enrolled in college. There was just a variety of situations and rules around when individuals got kicked off of their parents' plan. So the Affordable Care Act standardized that and said dependents up until age 26 could be covered under their parents' plan, which obviously brought in a whole host of individuals who either didn't have employer-based health insurance, were unable to afford individual health insurance, or otherwise were kind of in that gap where they were making too much money to meet Medicaid standards, but did not make enough money to participate in health insurance. And maybe we're not working full time yet. Maybe we're part time in school, or we're just starting their careers. It also established the health insurance marketplace, which provided subsidized individual plans. So if your employer did not offer health insurance, or that was unaffordable, or you did not meet the criteria for qualifying for Medicaid or Medicare, then you could purchase on the health insurance marketplace, which provided more affordable individual health care plans that could be purchased by individuals. Additionally, it standardized preventive care. So prior to the Affordable Care Act, some preventive services were covered by insurers. Oftentimes, like juvenile or pediatric vaccinations would be covered. Sometimes a yearly checkup would be covered, but it really varied plan to plan. And the Affordable Care Act standardized what preventive services all health insurance plans needed to offer. And the thinking here was, if we standardize preventive care, if we get more individuals participating in preventive care, we will have fewer long-term chronic health conditions that drain the healthcare system, that place a burden on our healthcare system. So it did, and raise up those healthcare costs through overutilization. So it did put in standardized preventive care requirements for all insurers as a cost saving measure, as a way to kind of control use of the system, and as a way to improve the overall health of the population. So a lot of changes were implemented through the ACA. A lot of different reforms were implemented, but as you can see, it still worked within the same structure. It was still working with private health insurance companies in a significant way. That is what was brought about by the Affordable Care Act. So what did it do successfully? How did it fail? And what are we looking at moving forward? So in some ways, the Affordable Care Act was extremely successful. It absolutely extended coverage to millions and millions of Americans. I believe prior to the ACA, we were looking at about 15% uninsured, which is a significant percentage of the population. And I think our most recent numbers were from 2023. We are down to about 7%. So we about cut in half the number of uninsured Americans, which was a significant change. So millions of people who were unable to participate in healthcare or were only using emergency services for their primary care were able to actually get health insurance and participate in that system. It also standardized the coverage of preventive care, which I just discussed, which is a fantastic way to remove those barriers for individuals who otherwise would be, paying out of pocket for preventive care and maybe are unable to invest in that preventive care that really pays off long term, not just in terms of financially, hey, you're not going to be spending all this money later on dealing with a more complicated health issue, but it's going to just improve the overall health of the population and reduce the burden on our healthcare industry. Additionally, it did implement that marketplace, which was an option for individuals and continues to be an option for individuals to buy their own plan at a subsidized rate. And it did establish that process for expanding Medicaid at the state level. So it set a standard and provided some incentives for states to expand Medicaid. Now, these weren't all successful. So the individual mandate, which I talked about a moment ago, where we would have a penalty if we didn't carry health insurance for, I think it was like 10 months out of the year, that was repealed ultimately. So that is no longer an incentive or a threat, however you might view it, is no longer part of our healthcare system. If you do not want to carry health insurance or don't want to spend that money or are unable to, you are not required to. There's not a penalty. Another consistent issue that we faced is there's a lack of really quality, affordable marketplace plans. So if you've ever tried to get on the marketplace, it can be kind of a mess. And while there are options and you are able to get some basic coverage, you're not getting as high quality of a plan as you could get for the same cost through an employer. So it is not a one-to-one substitution, an employer plan versus a marketplace plan, and that's been a significant issue. Initially, we required Medicaid expansion at the state level. That was shot down. There's been a number of legal challenges, but the main thing that was challenged was the requirements for states to expand Medicaid, and that was ultimately shot down. So states are not required to expand Medicaid. They were allowed to if they wanted to, if they voted to do so. But the majority of states did, but several states did not expand Medicaid. So we did not get that universal improved access to Medicaid. And there's a variety of reasons why that was not as successful as we had hoped, but ultimately this is what we're left with is some states chose to expand Medicaid eligibility, some states chose not to. So there's an unequal access to Medicaid depending on where you live. We also did not do a great job at controlling prices. There were some additional legislations that were passed that worked on controlling specifically pharmaceutical prices, but overall, we've continued to see prices rise across the board. Some of the measures that we put in have helped control the prices at the individual level, have helped what the average American is spending, but overall health insurance prices continue to rise. The burden on the system continues to rise on that financial aspect. And moving forward, we're really at a point of transition with the Affordable Care Act. Politically, it's a very complicated issue. There are constant threats to repeal it. There are constant challenges to different aspects of the Affordable Care Act in court, and it tends to be a somewhat controversial, complex issue that we've not yet resolved. There is some unpopular elements. There are some religious objections to different portions of the ACA, particularly preventive services like birth control and other healthcare or other services that are covered under preventive care. And you get that other side of it. So you have complaints or rejections of the controls and the regulation of the industry. And then you also have individuals who say the Affordable Care Act was not successful because it didn't go far enough. It did not implement universal health care. There's a rejection of partnering with health insurance companies and seeing the Affordable Care Act as a giant subsidy for the healthcare industry, when we should have rejected the healthcare industry and maybe moved towards a single payer universal healthcare option. So there's a lot of different things going on with the Affordable Care Act. And it's not settled, and it's going to continue to be a complex issue that we're going to be wrestling with unless we replace the system entirely or repeal that that legislation entirely, which it could happen. But it would be very difficult as many of these features have become standardized throughout the healthcare industry, especially extended coverage, especially coverage of pre-existing conditions. But that's basically what I wanted to cover, make sure we have a foundational understanding of what the Affordable Care Act actually accomplished and what it didn't accomplish. So if you do have questions or concerns, want to discuss this further, absolutely reach out to me. We can go into this more in depth. There's so much to discuss when we talk about the Affordable Care Act. And I really encourage you to, one, look at things objectively and from an unbiased standpoint, as unbiased as you can, because often the narratives around the Affordable Care Act are very politically charged, are very emotionally charged. So it's important that we look at what actually occurred, how successful was it, where did it fail, and what might happen in the future. So that's what I wanted to cover here. If you do have concerns, questions, please reach out to me, and we will definitely be digging into more of this material moving forward. Thank you.